Wade Norwood is the Chief Executive Officer of Common Ground Health, the health research and planning organization for the Finger Lakes area. In this role, he strives to address and learn more about the health disparities that plague our communities. It would also be remiss of me to not mention that Wade has long been a community leader and organizer from his work in politics and policy, as a leader in Rochester's faith community, and as a member of the Board of Regents. Wade really embodies the vision I have for this year through the work he does and the passion and perspective he brings. So I will invite him to take the stage and we can all learn something.
Angela, thank you very much, and thank you for that gracious introduction. I am sitting beneath myself and hoping that the share screen function will work. I am still learning all of this fancy technology. Can you all see my screen?
Yeah.
Yes.
Excellent. Then that means I did not mess this up a second time. Good evening, all. I am delighted to be here and to share with you all as you begin this year of advancing Rotary as a social justice organization. It is incredibly fitting that you would ask for a conversation with regard to the dual, or you might even say the triple pandemics with which we are struggling right now as a nation. It is not only a public health crisis, it is also an economic and economic equity crisis that's compounded by the fact that as a country and as a community, we are wrestling and confronting in a meaningful way the racial and ethnic divisions that have torn at this country since its founding. And in fact, as we know, even before its founding, we are 401 years away from 1619 and the African American experience in this country. So I am incredibly delighted that you all would invite me. I will apologize to my blessed bride and to Dave Hannon in advance because they probably heard this presentation 270 times in advance, but I will ask them to indulge us as we just share. For those who don't know, and I'm so delighted to see friends on this call, so I hope that those who don't know are limited in number. Common Ground Health is the health planning entity for the 9-county Finger Lakes region. We see it as our mission to bring focus to regional health issues through our research data and analytics, through our community engagement, and through the collaborative partnerships that we either build or in which we operate. And this map is quite literally a diagram of the 245 organizations representing over 500 individuals who sit at the 25 different tables that we currently convene. And we see this map as our secret sauce. As powerful and compelling as the data is, it really is the fact that, like Rotary, we bring together thinkers and doers in the community, really committed to the understanding that we can simply have reasoned conversation. We have the ability to surface that which we can do in order to improve the health and the wellness of folks who live here in the Finger Lakes. I think that as we approach conversation about the coronavirus pandemic, the most important thing to really understand is that COVID-19 and the way in which it impacts the different parts of our community differently is really not teaching us much about disparities that we did not know. But what it's really doing is it's surfacing and really underscoring the disparities that exist in our region. And I will say that this is a novel coronavirus. And there is much that we, and particularly Dan and Dave and their colleagues in medicine, are constantly learning and teaching us on a daily basis. And I am fascinated. I don't know if you saw the news, the Buffalo news last weekend, but it's beginning to really surface itself as a rural and suburban disease in Buffalo. And I think that's a harbinger of what we're going to see here, what we're going to see around the nation. And I think that it is also stunning to think of the news that greeted us this morning of how the pandemic is playing out among the younger people and what that might mean for college campus communities, and for us, as we are the home of a college campus, what this might literally mean for us. This is fascinatingly unprecedented, and we're all going to continue to learn as we go through this experience. But this is data as of the start of June that I can share with you. We'll be refreshing this in the course of the first part of next week. But if we look at what testing data looks like here in Monroe County, the positive test rate really does reflect a disproportionality among those in our community who are African American or Latinx than their white neighbors. And that testing disparity is really showing itself through the data in terms of hospitalization, in terms of assignment of hospitalized patients into ICU units needing a ventilator. And sadly, it is also playing out as we look at what the death rate has looked like here in Monroe County so far. And it is important for us to think about the fact that not only is this a disease that is highly transmissible, not only is it a disease that has a predilection of preying on those who are obese, have hypertension, who have diabetes, all of which are diseases that are disproportionately felt within the Black and Latino community. But it is also a disease, because it's so transmissible, that is prone to be experienced by those whose workaday lives bring them into high contact, close quarter situations. And those generally are, sadly, the lowest paid jobs in our society, and the jobs that are not only occupied by low wage workers, but also disproportionately by Black and brown workers. And so thinking about the pandemic brings us to, this is one of my favorite cartoons. And if a picture is worth 1,000 words, I have a lot of pictures here, and it'll spare you all listening to lots of words. But this is a map of the Finger Lakes region. Lake Ontario to the north, the Pennsylvania border to the south, Buffalo to the west, Syracuse to the east. The Finger Lakes region pictured by zip code. And each zip code is color coded as a reflection of the socioeconomic status of the folks who live within the zip code. SES, our shorthand, is a composite measure that we create at the Common Ground Health, and it reflects the poverty rate within the zip code. It reflects the per capita income of the households and the folks who live in the zip code. It reflects the unemployment rate in the zip code and the percent of adults who live within a zip code who are engaged in the labor force. It also reflects the type of occupation held by those folks in the labor force, as well as reflecting the household composition of the homes in the zip code. And each of those measures are put together so that the darker color reflects how poorly across those measures the folks within each zip code fare. And the lighter the color, the wealthier the folks who live within each zip code. And so since we are small in number, I can do what I love to do when I am in a face-to-face setting, which is I'll invite you to unmute yourself, and I'll invite anybody to respond to the Rorschach test and tell me what you see as you look at this map of the Finger Lakes. Don't be shy, it's not a trick question.
A lot of poverty everywhere.
John, say that again.
A lot of poverty everywhere.
A lot of poverty everywhere. I think that we tend to think of the Finger Lakes region and think that poverty is something that is consigned to the limits of the city of Rochester, which is the little cross-shaped area in the upper left, and the city of Elmira. And the facts tell us the absolute truth, that John Boutte is a genius, and the reality is poverty is everywhere in the Finger Lakes. What else do you see?
I'm seeing the poverty. I'm looking at the Rochester region, and there's like significant poverty across the city, yet right on the outside, we have SES 5, like surrounding the whole right side of it.
I think, Eleanor, absolutely. It stuns me to think that the truth is not that poverty is concentrated. Poverty is really everywhere. The truth is the wealth is concentrated. Mm-hmm. And it's concentrated exactly where even the poorest kid in our region knows where the wealth is. The eastern suburbs of Monroe County and the northern half of Ontario. If Bill Johnson's Fatal Crescent is still on our lips, by golly, we ought to be talking about the Fertile Crescent, the landed gentry, and the fact that it is so starkly cheek by jowl with poverty explains why you can drive Route 33 starting in our neighborhood and drive it for 10, 15 minutes, and you move from extreme poverty to extreme decadent wealth. Anything else, my friends? The other thing I would note is if you look at the upper right hand, you get to see Wayne County. And you get to see this amazing distinction of half of Wayne County being blue and the other half not. That is absolutely the impact of urban sprawl and how the wealth of Webster is pushing eastward and displacing all of those farm workers and pushing them to the other side. You get to see the same thing in Livingston, the extreme left-hand side going down, and you can see how Livingston County, north-south, has an equal such division. The face of sprawl and the impact of sprawl continues to be felt, and I really wish we had the ability to drive our data down to the census tract level in the rural areas the way we can in the city, because we all can understand that around each of the Finger Lakes, if we could get a finer view, we would see that the lakefront properties would be bright gray, distinguishing themselves from the rest of the rural areas that surround the lakes. This is the same map, but on this map, the color coding depicts not what's going on socioeconomically, but rather what's going on with health. This is a measure of years of potential life lost, which is a great measure. It's one of my favorite health measures because instead of being a measure of mortality alone, YPLL is a measure of the age at which people pass. And when we look at premature death, we really begin to understand the impact of disease on a community. I often note when I show this map, my dad's family has a long history of diabetes. Almost everybody dies as an amputee of kidney disease, of cardiovascular, or of a stroke. It's just how people go. We grew up just saying it was sugar. Everybody in the family had sugar. And it was normalized. And so the fact that Aunt Becky died as a double amputee did not really strike me growing up. But on this side of 50, I now sit and reflect. There's a tremendous difference between my dad's mom, who died at age 93, and believe me, it could not have occurred one day too late. The lady was so mean, we never thought she would ever die. But a very big difference in her death at 93 and my dad's death 3 years earlier at 63. Nan lived to a ripe old age. My dad died only having seen one of his grandchildren graduate from high school. I christened all of his great-grandchildren. And a very big difference between my dad's death at 63 and my cousin Reggie's death 2 years earlier at age 40. His son had not even started kindergarten when he died. So I like looking at premature death because it really lets us understand how family systems, how neighborhoods are impacted when people don't enjoy health so that they can live to the ripe old age that my Nan did. And I hope that the similarities and the coloring of these two maps is not lost on you. Because if there's a first takeaway I'd love for you to have from this conversation, it is the fact that poverty is literally killing us. And we are not going to address this problem without taking the time to really understand that this is not a reflection of what's going on inside the medical world. This is a reflection of what happens in the community. And I am incredibly delighted that it has been in my lifetime that the university has begun to understand the value of the work that Glenn and his team does, to understand that we have got to move the power of the university off of the campus and into the community. And we've got to recognize the incredibly powerful work done by clinicians like Dan, who are actively engaged in denying that the university is going to be bound by a river, a hospital, and a cemetery, that it is actually going to be engaged in the classrooms and around the kitchen tables of not only our neighborhood, but throughout our community, to make sure that we are doing all that we can to equalize outcomes for the folks who live in this community. And since we're a data shop, we spent our time saying we've got great data that tells us what we need to get a better understanding of the why. And so in 2017, we committed to creating a regional survey that we could carry out into the community and talk with our neighbors in the Finger Lakes and see if they could help us understand why these maps look the way that they do. And we developed this survey in partnership with all of the county health departments in the Finger Lakes region. We took the survey out into the field in the summer of 2018. We spent 2019 interpreting the data. and 2020, we have been out doing presentations like this. Our aim was to get 2,500 responses to our survey so that we would have a statistically valid sample. We wound up with almost 7,000 completed surveys, and we hit our oversampling targets by race, ethnicity, age, income, and geography, so that we can cross-tab at the 95% confidence level, and we can cross-tab to a fairly well. And I'm going to share with you some of what came out of our findings. And I would tell you that the most significant finding in my view, and I'm asking for you to let it be your takeaway number 2, is that if we're going to make a difference in terms of people's physical health, we really need to focus in on their mental and emotional health. When we did this survey, what we found was 90% of the adults who live in the Finger Lakes region reported to us that they would rate their mental health as good, very good, or excellent. And to come in at 90%, I think is a source of pride that we can take, that we are blessed to live in this incredible community that we live in. Our commute times are easy. Our income is relatively high. Our housing market is relatively stable, and we can do all of those wonderful things that we need to do to pat ourselves on the back and pride ourselves in being a great place to live, work, play, and pray. And it is why I beat up on my son who lives out in LA to say to him, you need to come back in Rochester and you need to raise your family here, because this is a great place to raise a family. But the problem with data and my intellectual curiosity is that this is, for me, always a matter of peeling the onion, that there are stories beneath the story. And the more layers I peel, the more it makes me want to cry. Because of the fact that although we could say 90% tell us this, we have to recognize that means that 10% of the adults who live in the Finger Lakes region tell us that their mental health is at best fair or it's poor. And if we just look at folks who live in households with household incomes underneath $25,000 a year, that 10% becomes 24%. And then when we look at those who are in low-income households and we ask them to rate the safety of their neighborhood, that 24% almost doubles to 44%. And then when you add in barriers for transportation, that 44% becomes 54%. And this, my friends, is the responses from the adults. When I see this data, I'm reminded of the African proverb that at the start of the day and the end of the day, the village elders should gather and ask the question, how are the children? If this is what the adults are experiencing, how are the children? And this is what the adults were experiencing in the summer of 2018. I wonder what we are going to see next year when we go replay this survey in a post-COVID, socially distanced, physically isolated environment. And so I'm delighted that you all have asked me in to kick off this year. I am delighted that Rotary International is really saying it's time to apply the four-way test to our conversations about social justice. Because of the fact that there is a hell of a difference between recognizing and doing. And the one thing that we are blessed with is Rotary International is a group of people who are about doing. Your projects, global and local, are significant, often unheralded, but always difference making. And I am eager to remain a partner and to build a deeper partnership with you all. Quite honestly, I'm eager to do so because it's the only way to make sure that Lisa will still cook and still let me stay here. I am eager
Yes,
to make
Lisa.
sure that our partnership is strengthened and that we're able to make sure that we're providing you with the information, the data, and the understanding that you need to bring greater focus to your work. I'll leave you with just a couple of very simple calls to action, to-dos that you might consider. One of them is to do what I am hoping my board of directors will do on Monday evening, which is pass a resolution that stands with the Rochester Black Agenda Group in declaring that racism in and of itself is a public health crisis that is actionable and to which we are committed its deconstruction. Secondly, we are incredibly aware of the fact that play is the brain's preferred way of learning, not just for kids, but for adults as well. And so we have been informed by the incredible work coming out of learning centers like the university and really promoting the power of play. And that the best and most effective way for us to talk to children and parents about children remaining developmentally on track is to really help bring back free, unstructured outdoor play. And so through this period of the pandemic, we went out in the month of May and June and distributed over 900 play kits. They are ready-made bags full of games, toys, instructions for play, and guides for parents in supporting children's play. It was so well received. We have requests for another 1,500. So we are ordering 2,000 play kits that we will be distributing in the months of July and August. And any and everything that you all can do that spreads the message of the importance of play, and particularly the importance of play outdoors in connection with nature, is deeply appreciated. We are running a Facebook series that we are calling Mythbusters. I think we're up to Mythbuster number 9 right now. Mythbusters is one of those times where my lisp and my stammer shine through. I didn't know that they would name it this, and I would have to say it as often as I do. But it is the lady on the left in the purple, Linda Clark, is a practicing doc locally and a member of my staff. And the lady in red is a registered nurse. And the two of them team up and they have the most incredibly funny series of conversations around health literacy that was really born out of some of the incredible things that have been floating. If you look at social media in the Southwest, at the start of this disease's progression, there were real statements that if you had high melanin in your skin, and melanated people had invulnerability to COVID. And so we did not need to take any precautions. Thanks to the president, there have been people who really believe that if you take a hairdryer and you inhale the fumes and you heat your nostrils, that will make you invulnerable to the disease. There's so much mis and disinformation floating. We have found this to be a very effective way of literally busting myths. If you can just direct people to our website, commongroundhealth.org, and or if you hear of anything that you think we should do as a part of this series, something that you think is ignorance with which we need to combat, we'd love to hear from you. We have been out in the community partnering with the county health department as it's been doing COVID screenings. We're offering and we're doing the pre-screening work that really has been a way for folks who have questions to really just have someone on my staff or one of our volunteers with which they can just sit and talk and share what their fears and concerns are going through this experience without having to consume the bandwidth of the county staff that's actually doing the screenings. And then most recently, and this is my last and final slide, we just finished doing a citywide mailing on our COVID symptom tracker. It is a daily bot with which you can check in free of charge. And as I said, I just find it amazing that the guidelines are changing so rapidly. I find this to be a way that I can check in each day. I don't have to scour the news for what the CDC is saying. The bot does it for me, and I'm able to just keep in touch with what my body is telling me and have guidance on whether or not I should be in touch with my doctor and or whether or not I should be venturing out in the world. We know the university has a similar tool that it uses for its workplace. Many employers are moving to do this, and this becomes something that's free of the employer, that's open and available to all the members of the community. So if you haven't been to rockcovid.org yet, take a shot and go check it out and experience it, my friends. In closing, and I'm happy to answer any questions that you all might have, but I am very much aware as I step away and give the talking stick back to Angela of Dr. King, who quoted John Donne when he observed that we are all caught in an inescapable network of mutuality. We're tied in a single garment of destiny, and whatever affects one of us directly affects all of us. King noted by continuing that John Donne hadn't said, "No man is an island entirely of himself. Every man is a piece of the continent, a part of the main. Any man's death diminishes me because I am involved in humankind. And therefore never sin to know for whom the bell tolls, because it tolls for thee." And King concluded with the famous words, "I must say tonight that I know that justice is indivisible, because injustice anywhere is a threat to justice everywhere." Thank you all for inviting me. I am delighted to answer any questions you might have.
Wade, can I ask you to bring your slides back up and
sure
go back
can.
to your maps?
Let's see if I can. I just said I sure can. Let's see. Yes. Yes, David.
We can't
Yeah,
see it.
I don't have the maps up on my screen yet, but you did highlight Wayne County and the poverty out here in the rural areas, and there's broad swaths of poverty throughout the rural areas of the geographic region for Common Ground Health and District 7120. But on this, okay, but yeah, bring up the maps there. Okay, the relevant point I want to make is that where I am from, Newark and Wayne County, which is south central Wayne County, immediately to the east of Rochester, where we are in socioeconomic status 1, and the years of potential life lost were in the second worst category. We have a Rotary Club in Newark with 112 members in a community of 10,000 people. And so I put the challenge forward to Rochester Southwest to grow your club because it doesn't take a wealthy neighborhood to find people who are committed to not only social justice, but improving the lives of people in their neighborhood. So I know you have some competition with your friends at Rochester Northwest, with Rochester Rotary, and throughout Monroe County. But I encourage you to grow the Rotary Club of Rochester Southwest. It will help you accomplish the goals that Angela put forward and that you've been working on since the inception of this club under Chris McDonald. So thanks, Wade. I just wanted to point out that poverty is not an exclusion of bringing people into Rotary. Thank you.
You know, one question I have for you, Wade. I had a chance to look at a presentation that the Physicians for National Health Program for a National Health Program put on the 23rd, I think it was, and it was certainly interesting to see how the cost of that would probably be less than what we're paying now. And the conditions, given the COVID pandemic, the upheaval, the social upheaval, kind of looks like there may be an opening for actually doing a single payer system in this country, and certainly in New York. And I've been working primarily with education issues, but you look at the fact that, gee, we may have such a shortfall of taxes that there's going to be a cut in the budgets. Looking at all the things we can push for, certainly having a social safety net that catches all the poor people who currently don't have health care or are not going to have health care if the federal government has its way. Have you looked at whether the data that you've got can be shared in a way that it advances the cause of getting a single payer program going in this country?
I say, John, first of all, I will use your comment to say another takeaway is please vote in November because there is so much at stake. For the love of this country, please vote in November. Number two, without a doubt, and back during the ACA and which was the passage of the Affordable Care Act, and about 2 years ago when the first round of impact data came out, I certainly have a presentation that demonstrates expanding coverage saves lives. Expanding coverage bends the cost curve. We have to expand coverage. But I say that my favorite slide, and some of you may have seen it, it is a bar graph of the combined health and education spending of the nations across the globe. And for the nations that lead in terms of health outcomes, the combined spending of health and social services really is about the same country by country per capita as the amount of spending in the US. The difference is if as those bars are color coded by how much is healthcare, how much is social services, we spend almost 2/3 of our dollar in healthcare, 1/3 outside of healthcare. Those other nations which are leading us in terms of outcomes, they're putting it into pensions so that older adults don't have to worry about the choice between eating, shelter, and medicine. They're putting it in schools so that children are coming out with the skill sets needed to compete globally. They're putting it in housing. They're investing in those things that we glibly call the social determinants of health we recognize but don't do anything about. And so I would be making the argument we need to have the conversation just as we're doing with regard to law enforcement. When it's time to call and say, I've got an emergency, we want 911 to send the right responder. If my house is on fire, don't send the cops. Get me a fire truck. We need to say, how can we engage the system and it understands this is not something I need a doctor for. This is something where I really need somebody who can make sure food gets on my table. This is where I really need somebody who can help me with the skill set so I can navigate. I think it's a bigger, more complex conversation, John, but I hope we can have it, because I really think if we start, my Nana, as mean as she was right about one thing. She'd say an ounce of prevention is worth a pound of cure. We have to start buying more ounces of prevention.
I was just going to jump in for 1 second and prove my own point that I find in a lot of Zoom meetings, and Wade, I have so many things I could ask you about, but I find in so many Zoom meetings that a lot of people defer to the older white guys with white hair. So I think it's great if the older white people can just be quiet and open it up to some other voices to ask questions. You guys don't need to hear from me. We got lots of talented people in this group besides us old white guys.
Yeah, I think we have time for one more question. Just in the interest of respecting everyone's time, we still have a couple of things to get through. So,
I have a question, Wade.
Yes.
How are those play kits that you mentioned being distributed, and is there a role for Rotarians to help distribute those?
Yay!
Not a planned question.
They were distributed by pure volunteer power and by my staff. Quite literally, David had arranged for Dina Faticone, my chief program officer, who is the creative spirit behind all of these things, to come in and talk at PETS. And that just got sidetracked because the world went sideways. I think that she would love to be able to enter into a conversation with the club and see how you might be helpful to us in making sure that kids here in the Southwest got access to those kits. So I'm about to throw my contact information into the chat box, and I would be delighted for any of the stranded questions. Fire them to me. I am a lonely soul and I love responding to email. And I will absolutely make sure that Dina is connecting back to you all through Angela. And we will absolutely figure out how to make the play kit work fun for all of us.
Thank you.
Thank you guys very much. I'll be quiet and I'll go on mute unless you want me to exit the building.